I'm Dushyant Sahani, Professor of Radiology. I'll share with you how I use spectral CT to assess patients with suspicion for bowel ischemia. This is the hanging protocol I prefer in patients with high risk or suspicion for bowel ischemia. One thing to keep in mind is these patients often present themselves in the emergency setting, and you don't have much time. You have to provide that information to referring physicians for presence or absence of bowel ischemia because a lot hinges on the information we provide. This is a time-sensitive diagnosis. So first, I will show the hanging protocols. On the left is the arterial phase monochromatic images reconstructed with soft tissue kernel using 55 keV. On the right side is a material density iodine image. On the bottom is a monochromatic images reconstructed in a coronal plane at 55 keV, as well as in the sagittal plane on the right side. So I start with the axial monochromatic images. We can go through the finding, which is pretty obvious, is this fluid in the abdomen. We start seeing some surgical changes. Probably patient had a gastric bypass in the past. We start seeing a lot of bowel distension. There is also a large distended lumen with a lot of material inside. And come and discuss this further. We keep going down. We look at dilated bowel. Now the question is if this is bowel obstruction, which can be managed initially conservatively and surgery can be performed later on if needed, or this is bowel ischemia. In the setting of bowel ischemia, it's a life-threatening situation, so one has to intervene faster. Also, many of these patients are older and might have comorbidities, so all that adds up to patient's risk. One distinction you will notice between the bowel that is extremely distended versus the bowel that is not distended is less enhancement, relatively speaking, and I will come to that finding again. We go down and we look at the same distended bowel, some bowel which is showing enhancement. There is not much enhancement in this part of the bowel. As we go down, we look at is there any transition point, and I will evaluate that further with the coronal and sagittal images. We notice this bowel is completely collapsed here. We go down further and we see the similar finding: fluid, a lot of bowel distension, as well as poor enhancement of segments of the bowel loops. Now we will go on a coronal images here, and just to evaluate the bowel anatomy, as we can understand, the small bowel has a long convoluted course, and it's very difficult to unravel its course on axial images. I often prefer the monochromatic coronal images to page through these bowel loops, and as we can see, dilated bowel. This bowel loop here, these are small bowel loops. They are distended. They are not enhancing well. Now we can go and look at the vascular structures, especially the arteries. This is the superior mesenteric artery, and that artery is pretty patent. We can also look at the superior mesenteric vein here and the portal vein. It's mostly patent but slightly attenuated, likely from the pressure. Now let's go and look at the material density iodine images and its value. So here we have already established bowel distension, but you notice that the bowel that is collapsed here has more avid enhancement of its mucosa in the wall. That's a very important finding, whereas this bowel, which is distended, shows no obvious enhancement. That tells me this bowel is either completely dead or at the risk of being dead. So now we notice that the vessels are patent, but the small bowel, a long segment of a small bowel, is distended and it's not enhancing. Now, I will also look at the sagittal images. just to further assess the vascular structure, especially the entirety of the length of the superior mesenteric artery and vein. Based on what information I provide to my emergency medicine colleagues, they will make a decision of intervention. So here, after assessing everything, I'm convinced this patient has a long segment of small bowel which is completely dead. I will call my colleagues in the emergency medicine, tell them this patient has a dead bowel, which is typically managed by a surgical intervention. And this is how I use spectral CT in my practice in the emergency setting to assess patients with suspicion of bowel ischemia.